วันนี้มีผู้ป่วยยืนยันเพิ่มจำนวนทั้งสิ้น60รายนะครับ
นับเป็นลำดับที่722ถึง827
On January 12, 2020, Thailand reported the first case of COVID-19 from an individual who traveled to Wuhan, China. It was the beginning for Thai people to be concerned about outbreaks of COVID-19 after it had been affecting many regions of the world. Meanwhile, medical teams around the world put effort into preparation in order to handle the situation.
ผมคิดว่าเหมือนกันทุกแห่งนะคือเราก็สนใจเพราะว่าพอปลายปีที่แล้วเริ่มมีการระบาดที่อู่ฮั่นทุกคนก็มีความรู้สึกว่ามันจะมาเมืองไทยไหมแต่พอเดือนมกรามีคนแรกติดในประเทศไทยละก็เริ่มเห็นถึงการระบาดค่อยๆเกิดขึ้นมีการตั้งศูนย์บริหารจัดการ situation ของโควิดเนี่ยแล้วก็จะมีหน่วยงานต่างๆเข้ามาอยู่ภายในศูนย์นี้ควบคุมทั้งในเรื่องของสินค้าไม่ให้ขึ้นราคาเรื่องของอุปกรณ์ทางการแพทย์เรื่องของมาสก์เรื่องของอะไรตามอยู่ในศูนย์นี้ทั้งนั้นหลังจากนั้นก็จะเริ่มมีการประสานงานกันในระหว่างหน่วยงานที่เกี่ยวข้องคณบดีคณะแพทย์ทุกคณะที่เกี่ยวข้องประธานราชวิทยาลัยแพทยสภาแพทยสมาคมกระทรวงสาธารณสุขตั้งแต่ปลัดกระทรวงทั้งหมดที่ต้องประสานงานรวมกันทุกคนรวมกันได้จริงๆ
Being the wisdom of the land, Mahidol University promptly takes part in the fight against COVID-19 with over 130 years of experience, starting the first medical school in Thailand, continuing to provide knowledge in medicine and health sciences, producing healthcare professions, and developing medical innovations. These are invaluable for the fight against COVID-19. Under the circumstances that Thailand is facing with the emerging disease, the opinions of academic sectors, including from Mahidol University and many leading organizations, significantly influence Thailand's policy and measures against the COVID-19.
At that time at our hospital, we set up the so-called upstream strategy and downstream strategy. We sent our team to join the committee of both upstream and downstream strategy. The downstream strategy arranged by the Ministry of Public Health. The downstream strategy means how to reduce the mortality rate, how to improve the discharge rate, reduce the number of admission, the mortality rate. So it kept talking about the PPE, the N95, the drug that kill the virus. They talk about all of this. At the same time, CILA decided to move to do the upstream strategy. The upstream strategy is to reduce the number of new cases. We suggest people to stay home, to use the face mask, to clean their hand, to do physical distancing. We have done a lot of clips into the YouTube. We start into the social media, asking people to do what we suggest. At the same time, we explain them the reasons. If you can reduce the number of new cases, there will be a reduction in number of patients need the admission. So it means the resource that seem to be lacking will be enough to be used because the number of cases admitted in the hospital seems to be decreasing.
Around mid-January, there's the announcement of the genetic coding of this COVID-19 virus. We let our virologist team to do their best to identify the antigen of this virus in their lab. By the end of January, we were able to identify this COVID-19 by using the RT-PCR technique. We set up these services to detect the nasopharyngeal swab for the COVID-19 in late February. Around March, that we begin to have more and more cases. We decided to do the service to screening this antigen of the virus 24 hours. In some day, we have to do the screening test for this RT-PCR more than 1,600 cases a day.
To reach the goal of minimizing the number of new infected cases, we had to stop the viral spreading. Still, in March 2020, the number of cases suddenly rose up from a cluster at boxing stadiums and nightlife entertainment venues. There were more than 100 new cases each day. Eventually, Medical supervisors from Mahidol University, collaborating with other leading organizations, recommended we implement measures to stop transmission, which later on, leading Thailand lockdown policy in April. During the lockdown, the virus detection was still continued, but collecting samples from people put medical professionals at risk of getting the virus. Therefore, alternative sample collection was implemented to minimize the risk.
To collect the nasopharyngeal swab, staff have to wear the PPE. They have to put the small plastic tube into the nose. This one is make irritate to the suspect case, then may spread the virus to the collector. We try to find the alternative sample collection method to collect the sample to test with the COVID-19. The previous report, they show that saliva can be used to test virus. Then we decided to do the research, compare between the saliva and nasopharyngeal swab. The result also show that the sample of the saliva and nasopharyngeal swab get high accuracy, about 80%. Then we apply to use the saliva as the beginning assessment for the student that want to go to the school and the staff that want to go to work.
Moreover, there were methods developed and sought out which were easier and cheaper to detect the virus along the way.
The magnetic bead RNA extraction kit and the COVID-19 XOM colorimetric detection kit. RNA extraction method using the magnetic beads for the COVID-19 XOM colorimetric detection kit. This technology is a qualitative test based on a colorimetric loop mediated isothermal amplification or LAMP assay and use of the signal orange as the indicator for the detection of the SARS-CoV-2 RNA extracted from the clinical specimen of the suspected person of COVID-19, with appropriate for the surveillance application with the limited access to the centralized laboratory. And this test has 100% specificity, 92% sensitivity, and 97% accuracy.
And for the sake of accuracy, housekeeping gene detection was adopted in order to assure the test results.
Actually, housekeeping gene is a novel innovation. Housekeeping gene refers to the host gene which has been commonly used as an internal or endogenous control in molecular technique. We always combine this housekeeping gene testing with the molecular diagnosis of viral diseases. So this can help to avoid the false negative result because of inadequate specimen. Back to the April when we established our molecular diagnostic lab for infection, that most commercial kits did not provide the housekeeping gene control in the reactions. Therefore, we designed to add the housekeeping gene testing with SARS-CoV gene testing to make sure that we can report the true negative result.
During the lockdown, testing continued. The Faculty of Medical Technology at Mahidol University, in collaboration with the National Health Security Office, NHSO, performed surveillance testing in vulnerable populations, such as those in confinement, slums, and homeless people, who are susceptible to getting viral infection.
The Faculty of Medical Technology has a very good chance to work with the National Health Security Office to provide proactive testing for the vulnerable groups, such as the homeless people in various communities and the prisoners in jails located in Bangkok and neighboring provinces. It is known that the homeless people may have high risk of COVID-19 infection due to the high possibility to expose to the disease, as well as the lack of access to the health service system. For the prisoner, it should be the best to prevent the dissemination of COVID-19 from the newcomer to get into the jail, since it is a closed and crowded area. Our findings reveal that the governmental policy is very effective to control the spread of infection, in which there is no significant evidence of disease dissemination among the homeless group. We think we are on the right track since in September the 2nd, we have found that one of the prisoners got infected with the SARS-CoV-2. During that time, that was the first case of domestic infection in Thailand after 100 days of disease. In the control the disease can be done immediately, in which no consequence was observed either in the jail or in the community.
Mahidol University also supported communities by facilitating the local government body of the community to create its local quarantine system to prevent the spreading of COVID-19 in communities. One example was in the Sung Nun district of Nang Konrate Sima province.
The university expects us to support any of the programs that can help in minimizing the burden of COVID-19. So as the Faculty of Public Health, what we are keen of doing is trying to work with the community. We are talking about the whole district as the social determinants of health. So once the COVID-19 became a problem, the first problem that we have to encounter is the feeling of the people, whether they believe it, how to get them to change their behavior. We know the guideline and we know the community. So we are the middleman to translate the policy to be relevant to the people and the culture of the people in that community or in that area. The village health volunteer. Before the COVID-19, some of them been trained to convey the message from the training. So we recognize that some of those messages not relevant to the context and to the feeling of the people. And we asking those who have the problems, those village health volunteers to come together and enhancing their skills in accessing the information, analyzing and comprehend the information that they should take into consideration before they make decision. And once the guideline, the policy regarding the COVID, this group of people start to share, information, different information that being spread from the government, from the people who just put in the line group. They're able to analyze and take the tips of what to prevent, how to do it. So wearing mask, not to go out, and cleaning hands often became the key issues that people start practicing. With that level of culture being stimulated by the Peer for Progress Network, people willing to follow because they feel the caring.
For care of COVID-19 victims, medical personnel provided their best patient care with different stages of disease severity. At Mahidol University, the cases with severe problems were treated at these two super tertiary care hospitals, Siria Hospital and Ramatiburi Jakri Narubudin Institute branch of Ramatiburi Hospital.
Because of it's a novel disease, we don't know how aggressiveness of the virus, how infectivity, how easily that the virus can spread, what is the treatment of choice, we don't know. And the manifestation of the COVID-19 pneumonia different from other pneumonia that we encountered in the past. From the information that released from China, the patient who developed COVID-19 pneumonia, that's allowed 50 to 60% of the patient develop pneumonia. But only 5 to 10% of them develop severe pneumonia. That means that your lung become from black lung, it become whitish lung. And then you cannot breathe by yourself. That is a severe pneumonia with failure in medical terms. During 6 weeks of caring moderate to severe case of COVID-19 pneumonia in Silat Hospital, we encountered 106 patients. 15 of them, or around 10% of them, developed severe pneumonia requiring intensive care monitoring during that period.
We need to set up the new ICU system for COVID patients. Then we change the ICU ward, which comprise of FAIR or F negative rooms into COVID ICU ward. we set the small team for each patient. One team comprised of 1 to 2 doctors, 1 to 2 nurses, assistants, and so on, according to clinical situation. Then we can limit the use of PPE, limited the use or limited the number of re-entry out and in from the AIIR. As a result, we can provide effective treatment, not only for the good point of care regarding the patient's care, but also we can limited number of PPE and prevent the medical personnel infections.
In terms of medical care, they COVID patients from other patients. The Faculty of Tropical Medicine set up a satellite acute respiratory infection (ARI) clinic to detect the virus and take care of an ICU location.
During the early outbreak of COVID-19 in Thailand, we implemented many strategies to handle COVID-19 at the Bangkok Hospital for Tropical Diseases. We established ARI clinic that was separate from the main hospital to screen ARI patients. We private ward for admission of the PUI and COVID-19 infected patients. This strategy was designed to prevent the transmission of COVID-19 to other patients and the healthcare worker.
Because COVID-19 is spreading from respiratory droplet, and we don't want this disease to contaminate to our patient inside the building and also to our healthcare worker that work in the building. So that's why we set up the AI clinic before the first case of the COVID-19 was announced in Thailand. We have 2 examination room, nurse and for doctor to working in. We fully equipped with all the necessary things to diagnose. And we also have another room for the patient, like if you need injection or if you need special care, such as the blood examination, we also have the special room for this kind of a patient. After we examine the patient in AI clinic, if we confirm the positive for COVID-19 cases, we have to admit the patient inside the hospital. So that's why we close entire 14th floor as a cohort ward.
The same policy is implemented at Faculty of Medicine Ramatiburi Hospital, using Ramatiburi Jakri Narubuddin Institute as a sanatorium for COVID-19 patients.
After we to get a sense of urgency to our staff is to build a leading team. The leading team or the guiding team is the administration team of our hospital. And due to the uncertainty of COVID-19 operation, we need to amend some function of our leading team to make we work fast and more accurate. I set up a short-term goal for them, such as we will open around 30 beds from 122 beds to make them feel that this work is not too difficult. So when they success to open 30 beds, it's easier to open them all.
Confinement of the COVID-19 transmission with a lockdown policy made the number of COVID-19 patients dramatically decline. So the government began partially loosening the lockdown so people could gradually return to their normal lives.
We try to reduce the number of new cases. We call it the hammer strategy. Use the hammer to roll down, to lower the number of new cases. When the number comes down nicely, there's one parameter that used to be evaluated before we decide to call the dancing strategy. I mean, allow people to do some activity so that to reduce the stress, to improve the economy country. This parameter called R0 or R0. R0 come from the contact ratio, how many patients that you're going to contact each day or each time. If you stay home, the number is 0. Every time when you leave home, the more the people you contact, the higher risk you're going to harbor the virus. Or even if you have the virus, you're going to spread too. If you use the face mask, if you keep physical distancing, if you clean your hand, there's a marked reduction in the chance of probability to get the virus or to spread the virus. So we decide to explain this to the public. I think it worked because after this, combined with the state of emergency that the government declared and also the curfew, we reduced the number. Initially, the R0 was about 2 in Thailand, was around 2. We reduced it to about 0.7.
Meanwhile, people are still being encouraged to abide by the recommendations very strictly to halt the infection.
Early May, the government decided to do the dancing strategy to open some activities. And we suggest the government, we agree that we need to evaluate. Every time when we implement this dancing strategy, we have to evaluate. So the government agreed with us to monitor every 14 days. Every 14 days, if there are no increase in new cases, they go into the phase 2. We move toward until the phase 6, that we open almost all the activities. The number of new cases are almost 0. We have some new cases, but all of them were in the state quarantine. And there's something happened in July or August. There are some pilot from Egypt, and they come to Thailand, and then they escape all this speculation, and then they spread out. Although we can control, we are lucky enough that there are no spread of the infection, but we realized at that time that most of the Thai, they are still concerned about the safety. But we got the very low cases, so they decide not to use the mask. We here in Mahidol, we send off some warning into the social media occasionally, try to convince people that you should not be in the comfort zone. Although there's no number, but there's a high risk of you're going to have a second wave.
In addition to providing care to COVID-19 patients, it is also important to maintain a high standard of care to non-COVID-19 patients.
By the time that we have to lock down the country, we have lots of problems with the non-COVID-19 patients like the diabetes, coronary heart disease, or the patient with the cancer, because they cannot come to the hospital to receive the general treatment. Therefore, we developed the telemedicine by using social media like the Line, Zoom, or with the Microsoft Teams to get access to the patients at home. We send all the medication via the post office. And we found that this way is quite nice because the patients need not to travel. And during the pandemic out of the country, we do cases more than 7,000 cases.
The Peer for Progress, as part of the non-communicable disease group, that able to change them from following the doctor's guideline into accessing information themselves and try it themselves by using the information that they have analyzed. Once they have applied it, they able to show the outcome, and we support them like blood tests or the improvement of their health. This is a way to empower them. During the COVID-19, the lockdown stage had made them plan of how to live within the household. They even predict that their glucose level might be increased, and they plan how to reduce it. And they're able to do it. They even plan to change their daily activities. Once we confirmed with them, in 23 days, they're able to manage it. This is help reducing the cost of healthcare, the cost of transportation. And they do it, continue doing it because they want to be safe and healthy.
Another factor that enables effective care of COVID-19 patients is the development of medical innovations to support services by specialized personnel of Mahidol University.
So first, during the time that we concerned about the virus and regarding to the vaccine, we also have the project that immediately they create to help the people to make the vaccine. That's what we call AI immunizer. which is using the robot kind of automation to help during the process. This one that will help to make the vaccine safer and also faster. Other thing that we also developed during the time based on the technology that we have, such as we have the robot that actually work in the industrial part, like a robot that work for deliver the things. So we have the project that actually work for our hospital to separate the patients and also the healthcare personnel by having the robot to bring in the food and also drug from one place to another place. So this will reduce the possibility that healthcare personnel will involve directly with the patient. This is what we call foodie. And also at the same time, we have another robot, which is a mobile robot also. It's a Westie that actually help to carry the bin or the waste from the patient's area that has the possibility to be the problem like a virus infection or something.
In the fact science and Rama Hospital Mahidol University, in collaboration with Thailand's Center of Excellence for Life Sciences, TCELS, have been developing antiviral medication made from natural extracts and Thai herbs, which are common ingredients in our food on a daily basis. The results showed that fingerroot, Chinese ginger extract, has potential therapeutic effects against SARS-CoV-2.
It has been about a year that we spent a lot of effort working on the COVID-19 research, particularly on drug discovery part. The first success was from the isolation of the live SARS-CoV-2 virus, and with the BSL-3 laboratory realization of this initial success, we in the same time collect hundreds of bioactive natural products that available in Mahidol University. We combine the two things together, that at least 3 crude extracts, the fingerroots, the ginger, and andrographis, are active against the live virus without damaging the good cells. They were working with low cytotoxicity. So that was the first success, that the crude extract from at least 3 plants could lead to potentially future drugs against the COVID-19.
Well, because of the Mahidol University, we have our strengths in life science and medicine. So many staff has expertise in several subspecialties and can provide the knowledge and carry on the research and develop many medical innovations to support such kind of crisis. So we applied with the how we can engage or contribute to such serious crisis in our country. And as we understand that our motto, the success of the learning process is not in the learning only, but in the contribution to the benefits of mankind. And this time we had contributed a lot to our people in domestic level and also in global regions to provide knowledge, sharing the idea, wisdom in resolving the pandemic condition. And our country has been recognized one of the best country that has capacity to handle such kind of COVID-19. So we are proud that we are one of the institutions that contributes to this kind of success.
The success of the crisis response Thailand has launched against COVID-19, from which Mahidol University, conjoining with many organizations, has earned praise from the World Health Organization, WHO, as a successful model for containing the spread of COVID-19. This work results from the united collaboration between doctors, faculties, and all staff at Mahidol University, who act in accordance with the philosophy of Prince Mahidol, which states, "True success is not in the learning, but in the application to the benefit of mankind."
So good morning. Good afternoon and good evening for everyone that attend our PMAX Virtual Field Trip 2021 programs today. Today is the first day of the program. I think that now many of you, I think I saw that it's almost 100 that attend this. We welcome all of you to our programs. And I think that you're interested in our PMAX Field Trip program. You might have a chance to look at our teasers already on the website. That this year we have 4 sites. Today is the first day is Mahidol University, and we have the continuous for 4 days, start from today until the 28th of January. And this is the good chance, even though we face with COVID-19 difficulty of that, but it cannot stop us to run the PMAC field trips as we ever run every year before the PMAC conference. So, but this year is very special because it's online program. You can attend all 4 sites because each site per day. Usually you have to select only one. So I'm very honored to be moderators of today's programs. My name is Panarat Wiswatemnimit. I'm a PMAC field trip working groups. I'm a nursing faculty of Parom Rachani College of Nursing Bangkok, nursing faculty, Parom Rachani Institute of Thailand. So today we are going to learn about Mahidol University, that as you see that in the topics of wisdom and innovation against COVID-19. You see that the Mahidol University have done a lot of things with our government, Minister of Public Health, and all involved sector. And today is a very welcome of you to our programs. And because this is a field trip, and usually we have a chance for all of you to share your experience and ask good questions. If you have any question, please feel free to type on the Q&A box. You can see Q&A box at the tab bar at the below, and then you please feel free to type that. And we have some expert to answer you, and we bring some question to the live section. I saw it have some Q&A box already, and we're gonna set that question. For the first thing that you see that today is very, I think it's very special that we have 6 faculties of Mahidol University together. You saw them in the video clips already, but indeed they are with us in live today and ready to discuss with you and talk with you. If you have any question, please feel free to type in the Q&A box. First, we would like to introduce all of the panelists today. So we have one lady that is a dean. So we will start with the lady first. So we would like to introduce to all of you to Associate Professor Dr. Chanuantong Thanasukan, Dean of Faculty of Public Health. Okay, the next one is Professor Dr. Prasit Wattanapa, Dean of Faculty of Medicine, Sirat Hospital, and Vice President Medical Council of Thailand. Then Professor Dr. Piyamit Sitara, Dean of Faculty of Medicine, Ramathipati Hospital. Professor Dr. Chachalerm Isarangkul Adutya, Dean of Faculty of Medical Technology. Associate Professor Dr. Chakit Suthakon, Dean of Faculty of Engineering and President of Engineering Dean Association. And the last one, last but not least, Assistant Professor Dr. Virapong Phumratanapapin, Dean of Faculty of Tropical Medicine. Okay, so all of 6 deans with us. So they're ready to answer and to talk with all of us. That if you have questions, please don't forget to type in Q&A box. If you type in the chat box, sometimes our expert cannot answer that. So as you see from the real clips, you will see that the strategies that Thailand use is start from the upstream strategy to downstream strategy. And of course, it is clear that Mahidol University involves with the upstream strategy and involved with the policy. Sometimes we have a problem with university, you might produce research or innovation, but how you take that data, how you take that essential of the important part to the policy levels, that is quite difficult. So we would like to start with, we have some attendee very interested in how the Middle University involved in policy in national levels. So that is very important question. Maybe the attendee would like to hear from Dr. Prasit first.
Yeah, I think this is a good example. At the beginning of this COVID-19 outbreak in Thailand, during mid-March, our past president of Mahidol University, he at that time just stepped down from the Ministry of Public Health, and he was asked by the Prime Minister and the management team of the government to get involved with the policy making level, how to manage this COVID-19. And not only him, but also our previous dean of Sila Faculty of Medicine, Sila Hospital, and also the 4 deans of the medical school in Bangkok, 2 from Mahidol University, that is Sila Hospital, and also Ramathipati Hospital, and 1 from Chulalongkorn University, and another one from Thammasat University. We set up a team, and we have a discussion between the academic people, I mean from the university side, and also the government side, particularly from the Ministry of Public Health. It's quite new, this virus. We know nothing about the virus, so we need collaboration, and we need a lot of efforts to work together between academic people and public health people. And at the beginning of the story of policy setting, how to manage this COVID-19 pandemic in Thailand.
Yeah, thank you, Dr. Prasit. So as we know that in this, it's just not only Mahidol University, but you mentioned that it's other university that join with the Minister of Public Health and government, and how we can have the policy dialogue. So this is very important, and the academic institute have to have the continuing policy dialogue to the national level for policymakers or high authorities in national levels to set some policy or regulation. So may I ask Dr. Piyamit Sitara, please, how you can, the Mahidol University, keep policy dialogue to the national levels? Yes, please, Dr. Piyamit. Yeah, can hear you.
I just try to unmute. Okay. What happened is that we have a meeting nearly every day in the emergency operating center that is head by the permanent secretary of the public health. And what happened is that we try our best to meeting with the private sector in order to make the policy dialogue, and we make it as a synergy between the Minister of Public Health and the researcher in the university. We try our best to find a relevant research to answer the important questions or the problem that we meet, whatever about the testing, about the treatment, or even the method of isolation. Thank you.
So for the policies, it has to be evidence-based policy. So that's why the result of research or the things that are from academic side can bring as an input. That's very important. As we know that in this Mahidol University didn't involve only the national levels. In this is a wide range of the policy, including in the local authorities, in community as well, because it's just not only the national levels that can, it's like a help for the people in the community to transfer the knowledge of the policy, but the local authority is very important. But how the MU or Mahidol University keep policy dialogue with the local authorities, and we know that the Faculty of Public Health have done a lot with this. Dr. Chamnwantong, could you please share with us about that, please? Excuse me, Dr. Chunantong, could you please turn on your microphone, please?
Do you hear me?
Of course, we can hear you now. Thank you.
Okay. At the Faculty of Public Health, I think we apply what we preach into the practice. We're fortunate to have Sung Nen District Research Center, and we apply the 3 pillars of health promotion, including the health literacy, healthy city, and good governance. For the good governance, we have been appointed as a member of the quality of life improvement at the community level, at the district level. As a committee member, we join and advocate the policy based on the information and the evidence that we collect from the district and sub-district level. So far, we have worked closely with all sectors in that district, including the Sung Nen Hospital, District Public Health Office, Village Health Volunteer, local authorities, patients, family members, and the community people. We able to advocate the policy and put the policy into practice at the community level, attending the monthly and in the communication with them through the social media, and get closer and closer every time that they would like us to join in the decision-making process.
Okay, thank you for the answer. In this, you have worked with the people in community and the local authority for a long time, right? Dr. Chunantong, you have worked with them for?
It's been almost 4 years, and we have a very good community mobilization principle applied there. People join us at the Health Research Center, and they even claim that this Mahidol Center belongs to them. And I think that is the good indicator that we're able to be part of the community as the principle of public health practice.
So that is a very important point, long relationship, and you work with them and they have a community engagement. I think you make them very empowered, so that is very important. So now we have many questions now. It's about the COVID-19 strains, about saliva test, and then we will continue to discuss about that. But before we go like that, we will go to in the clip video, you see that we used as people call the hammer strategy. And we have hammers and the dance strategy. So as you know that in Thailand, in the global, in the news, that we have the first wave, and now we have the new waves that are with the migrant, and it's quite difficult. But how we can control that? And as you see that for the first wave, we use a very strictly one. It's like lockdown the country. But for this time, in the numbers of the COVID-19 cases is more than the first time. But why we not lock all nationals again? We decide to lock only some provinces or some zone. So what is the reason behind that? But before we go with that, so for the lockdown or lockdown for some area, is that impact to the missions of the Mahidol University or academic institute in Thailand or not, and how we can overcome that problem. I think we have online classes or that kind of thing. May Dr. Chakit from the engineering, do you have that kind of impact for the lockdown or for right now that we have problems? Please, Dr. Chakit, please share with us.
Okay, so actually, it's really important that we concern about the data and information. So for this part, for our part that we have done, actually the contamination, and especially for how that we interact between the healthcare personnel and people that involved with the possible infection, that's very important. So this is a part that instead of that we separate the people between each other, we have the kind of the invention that we can help to provide the possible security for the healthcare personnel, such as using the robot that come in and help, especially for help the healthcare personnel to work and also provide the service to the people that has the infection. So in this case, we can actually also involve with the development in many things, especially for the innovation and also the data analysis and also the AI that come in and will be very helpful in this part. So this is my first answer.
Yeah, we saw in the news as well and in the clip video that is about robot, right? And AI that the Faculty of Engineering is like produced. In this, you produce all kind of this robot for the health side before, or this is just because of COVID-19 and we have to change the areas?
Okay, so actually for us as a Mahidol Engineering, our one of the main strength is about the research that collaborate with the medicine, especially for the research that involve with the surgeries and also medical applications in many medical applications. So in this part, at the time that we have problem with the COVID-19. So we gather our faculty staff together and try to find out that what that we can contribute. So to use a robot and some technology that available that we have, and also with the based on our research, this is that we come up with the several approach and some application that we use. So the robot that used for drug delivery and also the food delivery, and especially to help the healthcare personnel to treat the patients. This is one of the things that we try to immediately respond to what that we have situation in Thailand. And moreover, we have several other research that actually we have base background that we have been working, but maybe in a separate or different occasion. And so such as the robot that we use for the vaccine, especially that what we call the AI immunization. Previously, before the COVID-19, so we have the collaboration that work closely with the people who make the vaccine in our university, institute, and also hospital. So in this case, that would be very useful that we apply this thing to help in the process that actually is make things faster, safer, and also this is more accurate. And this is another part that we can contribute. So this is about what that Mahidol Engineering also work toward the COVID-19 problems that we face together at this moment.
Yes, this is a very interesting because we can use innovation to tackle the COVID-19 as well, because this is a health, reduce the risk of healthcare worker or the people that develop the vaccine. So, but in this, many people may question us because in some country, when they have the second wave, the third wave, they decide to lock down the national again. But for the second wave or our that we call new waves, right now, we decide to not lock down the nationals. So may Dr. Prasit can, what do you think about this? Why the first time we lock down the countries, but for this time, it's not necessary to lock down the country. Do you have any idea with this? Could you please explain us, Dr. Prasit, please?
Yeah, I think there are at least 4 reasons why we approach the second outbreak much different from the first one. Firstly, we know better about this COVID-19, the behavior of the virus, so we know how to tackle with it. I mean, at the beginning, during mid-March, we know nothing actually. We know nothing, but now we know the natural cause of the disease. The second one, we have better resources, more than I don't want to say that more than enough, but we have enough resources. The resources right here include the N95, include the virucidal drug, the favipiravir. At the same time, we do have the PPE to protect the healthcare personnel to be infected by the virus. And thirdly, we have several innovations. After the first wave, I mean, there's a lot of engineers, a lot of scientists who have done a lot of research and try to build or try to start doing some things in order to prepare ourselves for the second outbreak. Therefore, when we have the second outbreak, we have a lot of things to handle with the virus. And lastly, the experience. In the first outbreak, we have critically ill patients. We learned a lot from those patients, how to tackle, how to handle, how to save life with these critically ill patients. So because of these 4 reasons, I think we now realize that we need not to do the broad national lockdown. We can do the so-called selective lockdown, or what we call the targeted intervention. If you identify the risk area, if you can identify the risk persons by doing the testing and tracking and tracing, and then you can identify how to manage these people properly by using available resources. So this time, the Ministry of Public Health and also the academic people from the university, we have a regular meeting. We bring up the experience that we learned from the first round of the outbreak, and then we use it as a tool in order to identify or to select the appropriate approach how to handle with the second outbreak. Although you can see that the number of new cases per day, it seems to be higher than the first outbreak.
Yes.
But you see, we have a much low mortality compared to the first one. And not only because of the virus, but at the same time, I think the system has been well organized, better organized than the first outbreak. And I think that's the reason why the government decided not to do the broad national knockdown.
Yes, I think that we have the very good evidence and reason behind that. And we have questions that from the Facebook Live that because now we talk about the second wave. The question is like, should we now prepare for the third wave of infection? Do you estimate that we are going to have the third wave or not? And how we prepare for that? Maybe this is, I think maybe go to Dr. Piyamit or someone else would like to discuss in this topic or not, please?
Yeah, I think we are not finished with the second wave yet because there's still an big outbreak in Samut Sakhon province. And we cannot be sure that we absolutely control this second wave yet. Therefore, do not talking about the third wave yet because we still combat with the second wave.
As we heard that some people that COVID will be with us, maybe all of our life. Do you think about that? So it's okay, Dr. Chana. Yeah, okay, please.
I think that's very possible because the virus may mutate themselves, and we have to modify our vaccine in the future, very near future, and perhaps we have to vaccinate the people each year, very possible. So it's something like influenza that we have to continue combat with it for a long time. Thank you.
Yes, that is the point that we are going to discuss about the vaccine. But for now, we have a question that talk about the variant of the COVID-19. As you say that at the first period, we talked that the COVID-19 is from the variant from China and now from the UK or whatever. So is that, can you comment on the new variant and from the UK, or they will come to our countries or not? And is going to have any problem with the new variant or not? Because people don't understand sometimes what you're talking about, the variant of the COVID-19. So this is the question that from our attendee, from our friend from America. So who would like to answer for this, please? Maybe Dr. Chachalerm or Dr. Virapong, can you talk about the variant a little bit? The gene, yeah.
No, I think Professor Persit and Professor Piyamit, who have a lot of information on the DNA sequencing of the SARS-CoV-2, I think they could have some answer
Yeah, please. Maybe Dr. Prasit or Dr. Piyamit or Dr. Virapong, would you like to talk about the new variant, the variant of the COVID-19?
So I think the Thailand we have monitor for the variant as well because we have to do the genome sequencing for the COVID-19 infection that the B1.1.7 that have found in the England or the new variant in the South Africa. So at the moment, I think we monitor and we have to do the genome sequencing for the patient with the COVID-19 infection for monitor the variant. And I think Professor Prasit and Professor Piyamit have more information.
A little bit. Since we have not done the genetic sequencing in every case. Therefore, I do believe we already have this strain, this variant strain already in Thailand. You see, some of the COVID-19 patients in Thailand, they got the virus from Myanmar. And we know that up to 60% of the cases in Myanmar, they are in this variant, the D614G strain. However, I don't think it is important because we manage this strain exactly the way we manage the original strain from Wuhan. Although it spread easier, it spread easier up to 10 times of the original strain. But if you persuade people to do the physical distancing, do the face mask, to clean the hand, and to avoid staying in the crowded area, you can prevent yourself from this strain as well. Therefore, I think we handle the COVID-19 cases regardless the strain of the virus. And there's some evidence that this new strain does not have any serious condition. I mean, does not have the higher mortality compared to the original strain. Therefore, more or less, I don't think we need to identify the case which strain that they are having, but to treat it generally how like we treat the original one. Piyamit, yep, please.
So please, Dr. Piyamit, please. Dr. Piyamit, could you turn on your microphone?
Yes, I think so far we have only 4 cases reported of this strain, and we do randomly screening by do the genetic coding for this second outbreak, but we still not have a report more than 4 cases yet. I do agree with Professor Prasit that we have to use the same measure. There's no different, even the strain in this second wave have this variant or not. Thank you.
Does anyone would like to ask more about this? I think it's have one more questions about the genomic surveillance. I think this might be very hot topic right now. So thank you for Emmanuel and Derek that joined with us. And but I think you got the answer from the audience and other panelists already that we use the new normal behaviors and preventive measures about this. So Ajahn Chunantong, did the people in the community, they worry or concerned about the new variant or not? Yeah.
Yes, they kept asking, but for those who know how to check the information literacy, they are talking about, contrasting the information from different sources, and they know how to identify, and the group of people who are literate be able to advocate for the right information, right source of information. And I think this is what the literate person in the community had helped with the village health volunteer.
that we have to inform the people in communities, because the social media, internet, talking about the new variant, it might take some concern, but the data will help a lot for them. So now we have questions about the active case findings. So we found that for the case, and we do a lot of COVID-19 screening, RT-PCR or LAMPs, or a lot of techniques that we saw in the news. And we know that RT-PCR is quite expensive. Do we really need to do screening for everyone to ensure that we not have that COVID-19, but it costs a lot? Do we have another method or not? It's heard that some people talk about saliva test, or we saw in the clip videos that Ajahn Chachalerm and team went to the communities and do the screening. Could you please share with us, do we really need RT-PCR for everyone or not? Maybe start with Ajahn Chachalerm, please. Yeah, Dr. Chachalerm, could you please turn on your microphone?
Okay. Can you hear me?
Yeah, we can hear you now. Is it really need for everyone to do the RT-PCR to ensure that we don't have the COVID-19 in that area or in our country, but it's very high cost?
Yes,
yeah, please, Ajahn.
I do agree with you that the cost of RT-PCR is too expensive, and we also need some of the highly trained personnel, and we also need to have the sophisticated instrumentation. But I think all over the world, the active case finding is one of the most strategy used for prevention and control of COVID-19. And in Thailand, we have combined the active case finding to screen for the possible new COVID-19 infection across the country by combining with the identification and quarantine of close contact. And we do use the RT-PCR, which is the gold standard method, since it provides very reliable results, since it provides high sensitivity and specificity. And as I mentioned earlier, that there are some drawback limitation on the cost of the instrumentation, and we also have to wait for a very long turnaround time. But in my experience, we also use the RT-PCR as a screening tool. But for the saliva testing or the mass screening, may I ask Professor Pyramid and Professor Prasit to share to this point?
Yes, thank you. I think one of the bottleneck in do the testing in a big population is the time that we have to use for the nasopharyngeal swab. You might understand that for one chamber that is a negative pressure chamber, we can only do about 60 cases a day. In the outbreak, like in big factory, there might be 5,000 or 10,000 workers. And if we do want to do a speedy sample collection in all these workers, what we have to do is that we have to modify the way of collecting the sample. Using the saliva is one of the method that we prove that the sensitivity is around 85%. And that is quite enough for control the transmission, because the 15% that lost compared to the RT-PCR is that the one who have high CT or cycle time. That means the number of the viral particle is so small. Therefore, we will miss some of the percentage that not easily transmitted. Therefore, by using the saliva technique in control the disease in the big population, it's quite nice. And we published this data in a peer-reviewed journal already since May. And I would like to say that we also modified to some certain extent that we use the pool saliva in the low preference area. Suppose you think that area have less than 5% of the preference rate. We might pool 5 persons to do one test. That means for 100 subjects, we will do just 20 RT-PCR from the pool saliva test. That's one of the things. The second one is that about the modify the RT-PCR to the loop isothermal amplification test, or the so-called LAMP. That is quite simple by using the two genetic coding, same like the RT-PCR, but with just a single loop, not need many cycle time. Therefore, we can report that within 1.5 hours compared to around 5 hours with the RT-PCR, the standard RT-PCR. And the cost maybe just about 1/3 of the RT-PCR. And that don't need a big machine that costs more than million baht. We just used water bath that costs around 5,000 to 10,000 baht only. So that is another alternative to test for the antigen of the COVID-19. Thank you.
Yeah, so you publish the articles about the pool saliva, and that is very great. I think it's for use. If we use nasopharyngeal swab only, sometimes it's like the collector might have a risk and use PPE or what that is. And I think Dr. Virapong, right? So at the Faculty of Tropical Medicine, at I think we developed the new screening toolkit that use our domestic reagents. Could you please explain about this more? Dr. Virapong, please.
Yes, thank you very much. As Professor Pyramid mentioned, currently RT-PCR is the standard test for diagnosis of the COVID-19 infection. However, it has some limitation. It requires complex equipment, well-trained personnel, and the process is fairly long. Loop-mediated isothermal amplification (LAMP) can be used for screen for the COVID-19 infection. The LAMP test is sensitive, faster, cheaper, and does not require complex equipment. The LAMP yield 100% specificity, 92% sensitivity, and 97% accuracy. LAMP is useful for screening COVID-19 in some settings, for example, in settings requiring a rapid response, such as in the newly admitted patient, the pregnant women with labor pain, or in the emergency surgery, or in a community setting, such as in a surveillance for active case finding and the mass screening in low-risk population.
Little bit?
Yeah. Yes, please.
Yeah. I think in Thailand, one of the reasons that we can do an effective tracking and tracing is we use a combination of non-technological and the technological means. The non-technological means is we have a very good village health volunteer. We have more than 1 million village health volunteer that they are very good in identifying the risk persons. Anyone who get into the village, they are foreigner, and anyone who seem to get involved or to be infected by the virus, they identify those people. And then after that, those people will under investigated to do the testing, the several technology that you have been heard. So I think the combination of using this village health volunteer and also the effective screening, effective technological test and technical test by whatever the RT-PCR, the LAMP, or other kinds of, for example, the CRISPR, all of these things make people at risk of harboring the virus have been identified and tested. I think this is important, and I have to give the credit to the Minister of Public Health that they have a very good team. These 1 million people, they are very effective in identifying the risk person for us.
Yes, you're very right, and we recognize the roles of the village health volunteers and other sector as well, policemen or many people that help with us. But when we talk with village health volunteers, maybe Dr. Chanwan Tong can explain more about the roles of our health village volunteer during the COVID-19 management. Could you please share with us, Dr. Chanwan Tong, please?
Yes, I think not only the village health volunteer who are working at the front line in the community, we also have the public health officer at the sub-district hospital and at the district hospital, district public health office. They all together team up to use the information. I think it's the insider information, knowing each other, knowing who's coming back home, all of those. So the way they convey the message and identifying, like a timeline, it's not the individual timeline, but it's the timeline for that community. And that will help making decisions. So the decision that we make to suspect somebody who are at risk, high risk or low risk, it's not easy to have a clear cut. So the team at the village level, at the sub-district level, they have to work together. And then more of the people who are elderly, who are children, all of these people with the caring and understanding each other. But I think the Thai community has a uniqueness of caring and helping each other. We are so good at that, when we are confronting with some problems. But when we are all happy, we may have suspicious about other people. So it's the cultural thing, So the team at the village, at the community are crucial to managing the COVID-19 in all the way,
Yes, you're right. COVID-19 is like an enemy. And then we bring us together to fight with this enemy. And it's just not the village. I think the whole country, the whole world. That's why we here. And we have a lot of attendees from the foreigner asking questions. Of course, when we touch about the cost of RT-PCR or that kind of stuff, we have some questions that talk about the cost and who pay for that. Who pay for RT-PCR, who pay for stay quarantine or treatment, because it's very high cost. Maybe Dr. Prasit who can answer for the cost. If not, we can ask National Health Security Office to answer. But I think Dr. Prasit can share who pay for this.
I will start with, and then someone might add to this answer. Firstly, the government set up an emergency funding in order to look after those who get involved with the virus. And this funding will be used for all Thai people, regardless of whether they're under the vigilance scheme or under the universal coverage scheme. So all Thai people will be looked after. I mean, for the response, for the cost of the test will be covered by this budget. And likewise, the treatment costs. So all Thai people and also even foreigners who get into the country legally, they will be covered by this funding as well. And this funding will work like an immune system for other Thais, because looking after these infected people, it will prevent them from spreading the virus, and then it will improve the health system of the country against the virus.
Yeah. So does anyone would like to add? Yeah, Ajahn Piyamit, right?
The government look after all of this. I mean, both the screening and the treatment, even though the isolation when they got infected, to do the isolation, the government also pay for that. Thanks for the universal health coverage.
Yeah,
please.
Yeah, I would like to add on some more information. I think we all are very lucky to stay in Thailand since all the course of health services such as like screening, diagnosis, treatment, and prevention, as well as the active case finding, have been supported by the National Health Security Office, or what we call NHSO, for the whole group of the Thai population, including the normal group and the vulnerable groups. As you have seen in the video presentation, the NHSO also supported for the most of the vulnerable groups like the slum resident, the homeless, and the migrants, as well as the prisoner in the confinement. And for the migrant worker, we also, I think it is very lucky too, since the cost of the screening test has been covered by the Department of Disease Control at the Ministry of Public Health. Altogether, I think all the Thai population and the migrant worker, we are very lucky to stay in Thailand.
Yeah, that is a good point, and it's very useful of universal health coverage. As we know that in our countries, it's like universal health coverage is really effective, and this is a fulfill equities, and it's like a quality of life and of the Thai people. So now the questions come to very hot issue right now is talk about the vaccine. So before we in this, Dr. Jakit touched a little bit about AI immunizers. Could you please explain more about the AI immunizer, how it's involved with the vaccine development? And then some people ask about the advancement and how we prepare for the vaccine to allocate or distribute to all people. Maybe we start with Dr. Jakit, please, for the AI immunizer or for the vaccine development.
Okay, so actually, for the AI immunizer, the concept is that people that work in the field of creating the vaccine. So, in the case that there are some certain things that, especially for the contamination, we have the technologies and availability on the robotic system and so on. So we apply this robot to actually mimic the gesture of the human that work in the space that is like a protecting space that they can do the process in making the vaccine without reduce the possibility for the contamination and so on. So this is something that we can program and make the flexibility of the robotics that we use. Such a program, such a robot that we use is like a 2 arms robot that actually quite similar to human look. Like we have left arm and right arm that to perform the process during the protocol to make the vaccine. So that's an AI immunizer system that we work collaboratively with our collaborators in vaccine development people. But the other thing that is actually that you mentioned is really important that we also contribute is the research-based logistic related. Okay, so actually the logistic is very important. And once I have listened or the comment about the vaccine, so previously at the very beginning of the stage that we have the problem with the COVID, a lot of questions arise like where is the mask, where is PPE, the medical equipment that required and so on. So the logistic system is required, and we work closely with the Ministry of Public Health, with the logistics team to develop the like the urgent system that to gather all the information about the what we require, the information about where are goods that related to this thing. So it's coming along. When we talk about vaccine, right now our team also work on the logistic system that to help in the vaccination, how to distribute the vaccine also. So, but anyway, this is still on a process, which is there may be other speaker that has in deep detail on that thing. So this is something that I like to add on for the technologies that involved with the COVID at this moment.
Yeah,
Yes.
so that's very good because technology, this AI immunizer can help us produce the vaccine faster because they can work 24 hours, right? If people work, we cannot work 24 hours. I think this is good. So maybe Dr. Piyamit or Dr. Prasit can help us the developments of vaccine or the situation of COVID vaccine in our country right now. So where we can have it or how we can allocate it. So do you have any idea with this, please?
Yes, I would say that if you're talking about the vaccine development, we have at least 6 to 8 vaccine developments in many centers, but still far away from the mass production. The one that come in hand that we're going to have the mass production very soon is the technology transfer from the University of Oxford and AstraZeneca by the company named Siam Bioscience. And this is in the production period. I would say that on this very day, today, on the 25th of January, this is the harvesting of the first batch. That means they get just 1 milliliter from the adenovirus vector from AstraZeneca, and now they do the culture in the 200 milliliter, and this is the first day that they do the harvesting. They might harvest for another 3-4 days, and the sample will be sent to the AstraZeneca Center in Europe to identify the number of the adenovirus vector as well as the number of the spike proteins that's inadequate or not before they send to the Thai FDA for the approval later. So if we are lucky and everything in line, this first batch of production might come out in the end of May this year. In terms of procurement, the government also do the purchasing order for the Sinovac vaccine of 2 million doses of Sinovac vaccine, as well as another 50,000 doses of the AstraZeneca vaccine that might come in February. But in terms of production in our country, I think the first batch, if we are lucky, everything in line, maybe in the end of May.
Oh. It's a very good news. No? You said that maybe the February or May. That is very good. So many people talk about the side effect. We have very few time left. So how we deal with the side effect? Do we have to inject that? But some people say that if we inject the COVID-19, we might die or have some side effect. Do you have any idea with that? Should we have that vaccine or not? Maybe Dr. Virapong, would you like to answer this?
Yes. So the side effect, because the mRNA vaccine is a new technique, so we have the injection in Europe and in America, and they have reported some of the anaphylactic. I think it's quite in the few group of the hypersensitivity. So I think the side effect they reported in the most of the elderly patient. So all the patient who have a history of the severe allergy. So in that group we have to the close monitor for the severe side effect in those population.
Yeah. So I think that we have a healthcare provider and we know the side effect. I think we have to cross monitor and we have to look at your care. Or that is quite very good. So we have very few time left before we finish for this project. So I want to ask you to give a little bit idea what is the key success factors of the Michigan University and represent of academic institute of our country to take the role to tackle the COVID-19. Maybe very few words. Maybe we start with Dr. Chachalerm first. What is your key success factor? Dr. Chachalerm, please.
Yeah, in my mind, I think integration of good policy, good collaboration, and good behavior of the Thai people are the most key success factor that led Thailand to pass the COVID crisis very smoothly. As you can see from the presentation or at the panel this time, Mahidol University also worked with the major partner on the Ministry of Public Health together with the local health authorities. And I think this is the good key success factor. And I hope that the Thai experience will be useful for the other countries to fight with the pandemic coronavirus outbreaks this time. Thank you.
Okay, thank you. Professor Piyamit, very short, please.
Yeah, I agree. I would say in very short that the synergy is the best thing that happened in our country. Not only the leader from the government, the health minister, as well as the researcher from all the universities join hand together. Even the private sectors, they also contribute a lot in this outbreak. So I would say that the synergy is the keyword.
Yes, very good. So Dr. Virapong, please, very short, please.
So I think the medical innovation is one of the key success factors for the country. The National Science and Technology Development Agency and Mahidol University have developed a novel magnetic bead RNA extraction method and the alarm technique for diagnosis and for the handle the COVID-19 infection.
Yeah. So the way forward, because as you mentioned earlier, that we might face with the third wave, we might face with the COVID-19 or our lifetime or the next one. I don't know, maybe COVID 2021 or what, or as a future health response. Maybe what is the way forward for the Mahidol University or academic institute in our countries? Maybe we start with Dr. Chakit, please. Dr. Chakit, please. What is your way forward to tackle COVID-19 and prepare for the future public health response?
Okay, so actually we should rely on the fact and also research. And right now that we have been staying and facing with the COVID-19 for quite a while, we have more data. So technologies is available in many ways. So how that we can bring in the technologies to become very useful. And of course, the synergy is one of the very important key factor. Bring in the technologies, bring in the fact and research ideas, research base, bring up those things. I think put together, I think we can have the better prepare for the next COVID, another round that it would be happen. I think that would be the way that we can handle it.
Yeah. So we heard about synergy, research, and innovation. So what would I like to add, Dr. Chununtong, for the way forward of Mahidol University? Yeah, Dr. Chununtong, please, could you please turn on microphone? Yeah.
Yeah. Okay. I think what challenge for us because of the health and wealth that we all want. So next step for us, not only to identify the human capital, the health literate person, and also the social capital, that we have a very caring, forgiving, and learning culture, but how to balance it. So the next step is to create the knowledge of balancing public health and wealth together, we will survive. And that's what we intend to build up the body of knowledge for health practice.
Yeah, very good. Now we have to talk about the health in our policy in everything. So last but not least, Dr. Prasit, please, could you please add the way forward? Very short, please.
Yeah, I would like to wrap up the contribution of Mahidol, whatever in the past or even in the future, rely on the term Mahidol. That's the core value of our university. As long as we know something, we know in depth, something that we do not know, we do research in order to bring new knowledge. That's the term mastery. As long as we do it for others, that's the altruism. We keep working hard in order to save life, not only for people in Thailand, but also globally. At the same time, we work harmoniously with other people. That's the term H. And at the same time, we keep identifying new things, and we have the integrity to use it for the benefit of others, for the benefit of mankind. At the same time, we decisive. We have a determination in order to decide to do or not to do things. And also we keep on identify the innovation, use the innovation as the originality. And lastly, we have a leadership. We can manage, we can work with the leader of the government, we can work with people in the country and also other countries. So as long as Mahidol carry on the term Mahidol, I do believe the contribution of Mahidol will save life, not only to people in Thailand, but also we work together in order to save the world.
Yeah. So thank you that you wrap up. I don't have to wrap up anything, but that is good. That's why we use the themes of today, the wisdom and innovations. As you say that the Mahidol University, everyone, staff from administrator to staff, you follow the philosophy determinations that you want to be wisdom of the land, and follow the Prince Mahidol of Songkhla that talk about true success is not in the learnings, but in its application to benefit of mankind. It's very proof that MU are one of academic institute that tackle the COVID-19 along with other sector in our country and in the globals as well. So before we end, we would like to thank you all the panelists that is very insightful, informative for the input that you bring to us. So we would like to thank you everyone. So Dr. Chunantong, Dr. Prasit, Dr. Piyamit, Dr. Chatchalerm, Dr. Chakit, and Dr. Virapong. Please thank you very much for everyone. Thank you.